Hello students, myself Dr. P. Rajathi, Associate Professor from the Department of Oral Pathology and Oral Microbiology from Vinayaka Mission Sankaracharya Dental College is here to give a presentation on maxillary first premolar. Learning objectives of this presentation is, after this presentation you will be able to identify different types of teeth, identify premolars, know about the tooth numbering system, chronology, dimension, morphology of maxillary first premolar and the different aspects of maxillary first premolar. Before going in for the main topic, let's have a small introduction about the basics of teeth. The terminology tooth and teeth can be used when we are talking about a single tooth, that is terminology tooth is used. If you are going to talk about multiple tooth, the terminology teeth is used. Singular is tooth, plural is teeth. Coming to parts of a tooth, like the part of the plant that is above the ground, we call it as shoot, whereas the part of the plant that is seen below the ground, we call it as root. Likewise, the part of the tooth that is seen above the gingiva or above the jawbone, you call it as crown portion of the tooth, whereas the part of the tooth that is within the gingiva or within the alveolar bone, you call it as root portion of the tooth. Let's talk about the histological structures of the tooth for completion's sake. The crown portion of the tooth is covered by enamel. Enamel is a histological structure of the tooth which is going to cover the crown portion of the tooth. Likewise, the root portion of the tooth is covered by cementum. Both enamel, cementum or hard tissues, the center portion of the tooth is made up of pulp, which is a soft tissue, and it is the vital tissue of the tooth. Between enamel and the pulp, we have dentin in the crown portion. Likewise, between cementum and pulp, we have dentin in the root portion. So, the structures that you see in the crown portion of the tooth are enamel, dentin, pulp. Likewise, in the root portion, it is cementum, dentin, pulp. The portion of the dentin that is seen in the crown portion, you call it as coronal dentin. The dentin in the root portion is called as radicular dentin. Likewise, the pulp portion in the crown is termed as pulp chamber and the root is called as root canal or pulp canal. The tooth is attached to the jawbone by means of periodontal ligament fibers. These are the periodontal ligament fibers which is going to radiate from the tooth and get the tooth attached to the jawbone. The fibers are embedded both into the cementum and into the jawbone. That's how the tooth stays within the jawbone. Next, coming to types of teeth. There are 4 different types of teeth in human dentition. They are incisor, canine, premolar, molar. In which way are these teeth different from each other? The teeth that is seen in the front, when we smile, what we see, okay, that is going to have a flat surface, right? Those teeth are incisors. The flat teeth in the front, you call it as incisor. These teeth are used to cut and bite the food. Next to the incisors, we have canine. Canine is a sharp pointed tooth, long and sharp pointed tooth to hold and tear the food. Next to canine, you have premolars. Premolars are used to crush the food. Next to the premolars, you have molars. So, for premolars and molars, the chewing surface is going to be broad. So, these are the teeth which are going to help in chewing the food. Premolars to crush the food, molars to grind and chew the food. How many set of teeth do we have? Humans have 2 sets of teeth, that is deciduous teeth, which is also called as milk teeth, adult teeth, or which is nothing but the permanent teeth. So, we have 2 types of dentition, that is deciduous dentition, permanent dentition. In deciduous dentition, we have deciduous teeth, milk teeth or temporary teeth. In case of permanent dentition, we have all permanent teeth. So, deciduous dentition. Deciduous dentition comprises of 20 teeth, 10 in the upper jaw, 10 in the lower jaw. Upper jaw is also called as maxillary, lower jaw mandible. So, upper jaw medical terminology is maxilla, lower jaw medical terminology is mandible. So, maxillary teeth, mandibular teeth. So, within the upper jaw you have 10 teeth, right side 5, left side 5. Likewise, in the mandibular jaw again you have 5 on each side. What are they? You have in each jaw you have 4 incisors, 2 on each side. Next to the incisors, you can see 1 canine on each side. So, you have 8 incisors both in upper and lower jaw, 4 canine both in upper and lower jaw, and then posterior to. When you talk about back teeth, you call it as posterior. When you are going to talk about front, you are going to say it as anterior teeth. So, posterior to canine, you have molars. Here, in case of deciduous dentition, you won't see premolars. Premolars are absent in deciduous dentition. Posterior to canine, you have molars. So, you have 4 molars in each jaw, that is 2 on each side. So, a total of 20 deciduous teeth will be present. Whereas, in case of permanent dentition, you have 32 teeth. That is, similar to deciduous dentition, you have incisors. 4 incisors in each jaw, 2 in a quadrant or one side of the one jaw. So, incisors, central and lateral incisor, 4 incisors in a jaw. Next to incisors, you have canine. Next to the canine, you have premolars. So, premolars are located posterior to the canine. So, you have 2 premolars in one side of the jaw. So, you have 4 premolars in one jaw, that is 4 premolars in maxilla, 4 premolars in mandible. So, total of 8 premolars will be present. Next to the premolars, you have molars. Permanent molars, they are 3 in number on one side of each jaw. A total of 12 molars will be present. So, why do we have to have 2 sets of teeth? When we are kids, our jaw size is going to be small, so we have smaller teeth. As we grow and become adult, the jaw size is going to increase. Teeth, once formed, will not grow in its size. So, to accommodate for a larger jaw, the teeth, because it cannot grow, gets replaced by permanent teeth. So, it is going to be more in number and it is going to be bigger in its size. Deciduous tooth will be smaller in its size, whereas permanent teeth will be bigger in its size. Not only by size it is going to increase, but also by numbers it is going to increase. So, we will have 8 premolars, 2 per quadrant in each jaw, and 1/3 molar is going to be present in one side of the jaw. So, 2 per jaw comprises of 4, 12 teeth is going to get increased. So, 20 teeth will be present in deciduous dentition, whereas 32 teeth will be present in permanent dentition. Coming to surfaces of teeth. Surface that is going to be seen, okay, in the face, that you call it as facial surface. In case of anterior teeth, the surface that is going to face the lip, you call it as labial surface. When we smile, we see the labial surface of the teeth. Likewise, for the posterior teeth, the surface that is to be on the facial surface, you call it as buccal surface. In case of anterior teeth, the facial surface is labial surface, whereas in case of posterior teeth, it is buccal surface. Here you can see the labial surface of the anteriors, incisors and canine. For anterior teeth, you call it as labial surface. So, for the posterior teeth, you call it as buccal surface. So, coming to proximal surface, the surface on the sides of the teeth. So, when you divide the face into in the midline, okay. When you divide the face in the midline, the surface of the teeth that is going to face towards the midline, you call it as mesial surface. Whereas the surface of the teeth which is away from the midline, you call it as distal surface. Here if you see in this picture, this is the central incisor, right? In the central incisor, the surface that is towards the midline, you call it as mesial surface, whereas the surface that is away from the midline, you call it as distal surface. This is the lateral incisor. The mesial surface of the lateral incisor will meet the distal surface of the central incisor. It is going to be the same for all the teeth. Mesial surface of the posterior teeth will meet the distal surface of the anterior teeth. So here, but whereas in the midline alone, the mesial surface of the both the teeth will meet. So the mesial surface of the central incisor will meet the mesial surface of the right central incisor. Whereas in all other teeth, the mesial surface will meet the distal surface of the tooth. Coming to the inner surface of the teeth, the inner surface of the maxillary teeth is called as palatal surface. Why? Because it is going to be on next to the palatal bone. The surface which is going to face the palatal bone, you call it as palatal surface. The inner surface of the mandibular teeth, you call it as lingual surface, because it is going to be facing the tongue. Next, coming to the chewing surface of the tooth. The anterior teeth chewing surface, we call it as incisal surface. The chewing surface of the posterior teeth, we call it as occlusal surface. So the chewing surface of the posterior teeth is going to be broader. To concise, each tooth will have 5 surfaces, labial or buccal surface. If it is going to be anterior teeth, it is labial surface. For posterior teeth, it is going to be buccal surface. So labial or buccal surface. Next is going to be palatal surface. If it is going to it's going to be maxilla. Lingual surface when it is going to be in the mandible. So mesial surface and distal surface, and then the incisal or occlusal surface. So it's going to have 5 surfaces. Each tooth will have 5 surfaces. Coming to terminologies. When the surface is going to be flat, you call it as a flat surface. If you happen to see, instead of a flat surface, here instead of a flat surface, you see an elevation, right? So if you see an elevation, and if that elevation is going to be something like a straight line, okay, you call it as a ridge. So here this is the occlusal aspect of a tooth. Here you see a elevation. So this elevation in the buccal aspect, you see it as a ridge, right? So this is the ridge, a linear elevation on the surface of the tooth, you call it as a ridge. Based on the location of the ridge, you name it as labial ridge, lingual ridge, palatal ridge, and so on. So based on the surface where you see the ridge, you give the terminology as labial ridge or buccal ridge. So in the occlusal aspect, you can appreciate the ridge here. Likewise, on this is the buccal. This is going to be the palatal or lingual aspect. So here the ridge, you call it as palatal ridge or lingual ridge. Next thing is cusp. What do you mean by a cusp? An elevation or a mound on the crown portion of the tooth which makes up the occlusal surface. Okay, an elevation which is seen on the occlusal surface, and which this occlusal surface will divide the tooth, right? That you call it as cusp. So this is the chewing surface or the occlusal surface, right? Here you can see a lingual cusp, because this is the lingual surface, right? That is next to the tongue, lingual surface. So this is the lingual cusp, and this is going to be the buccal cusp, because this is premolar, right? So in case of molars, you can see 2 cusps on the lingual surface, right? 3 cusps is seen on the buccal aspect. So cusp is an elevation or mound on the crown portion of the tooth which makes up a divisional part of the occlusal surface. Here this is again is a premolar. You can very well appreciate the cusp, buccal cusp and the palatal cusp. How will you identify a premolar? So premolars will have two cusps. So and hence they are called as bicuspids. Premolars are the tooth with two cusps and they are also called as bicuspids. These are the, so two cusps, premolars have two cusps. This model is of 5 to 6 year old kid where all the deciduous tooth has erupted and permanent tooth has started forming. So this is around 5 to 6 years because you can see the permanent molars which is going to erupt. So this is the deciduous molar, right? So these are the deciduous molars. So premolars, where will it erupt? In place of the deciduous molars, premolars will erupt. So you can see premolars which is forming within the jawbone here. So premolars are nothing but the succedaneous teeth of deciduous molars. So for premolars, predecessors are deciduous molars and succedaneous teeth of deciduous molars is nothing but premolars. So premolars will erupt in the region of the deciduous molars. Once deciduous molars shed, there is going to be eruption of premolars and premolars will be located posterior to canine. This is the deciduous canine, right? So posterior to the canine, this is the permanent canine. Posterior to canine, anterior to the permanent molars. So premolars are located posterior to canine and anterior to permanent molars. Maxillary premolar, they are 4 in number, 2 on either side and they are located posterior to canine and anterior to permanent molars. I have already said maxillary first molar has two cusps, namely buccal and palatal cusp, and they are called as bicuspids. I am repeating it again. Maxillary first premolar has two cusps and also it has two roots. Of all the premolars, only maxillary premolar has two roots. Other premolars have a single root, whereas maxillary premolar will have two roots. So it makes it easy for you to identify a maxillary premolar. These are the tooth which has two cusps and two roots. So the roots are buccal and palatal. Why? Because the division that is going to occur in the apical 1/3 is going to be between the buccal and palatal. So you have a buccal root and a palatal root. This is the labial aspect of the maxillary first premolar. This is the palatal aspect, this is the mesial aspect, and this picture is the distal aspect, this is the occlusal aspect. So if you see the labial aspect of the maxillary first premolar, it will look similar to canine. Coming to tooth numbering system, there are 3 different types of teeth numbering system. Zsigmondy-Palmer notation, universal system, FDI system or 2-digit system, FDI Federation Dentaire International system. So in Zsigmondy-Palmer system, how do we number the teeth? In Zsigmondy-Palmer system, you divide the dentition into upper and lower half, right? So maxilla, mandible, and right and left side. So you divide it into 4 quadrants, that is right maxillary, left maxillary, right mandibular, left mandibular, and the tooth is numbered starting from the central incisor, right? So for central incisors, all the central incisors, the tooth number is 1, 2 for lateral incisor, 3 for canine, 4 for first premolar, 5 for second premolar, 6 first molar, 7 second molar, 8 third molar. So the tooth number for right maxillary first premolar is, you have to draw a mirror image of L and write 4. So that is the Zsigmondy-Palmer notation for maxillary right first premolar. For maxillary left first premolar, the same number 4, you have to write it L and then write 4. That's how you are supposed to number the tooth of the maxillary first premolar. In case of universal system, how do they number the teeth? Starting from 1 to 32, 1 starts in the maxillary right third molar, okay, and 8 is going to be So it is numbered from 1, 2, 3. From posterior teeth they start. Third molar, second molar, like that. Okay. 1 to 8. 8 is right maxillary central incisor. And 9 is going to be for left maxillary central incisor. So from 9 to 16. For 17 is for mandibular left third molar. 24 is going to be left mandibular central incisor, and from 25 to 32, that's how the universal numbering system is done for a permanent dentition. So if you can see, for maxillary right first premolar is 5, for maxillary second premolar the number is 12. Whereas in case of FDI system, instead of this grid, that is the quadrant system, they do number the quadrant as 1, 2, 3, 4. So first number 1 for the right maxilla, number 2 if it is going to be the left maxillary quadrant, number 3 for the left mandibular quadrant, number 4 for the right mandibular quadrant. So first number denotes which quadrant it is, whether it is maxilla or mandible, right or left. Second number, they have used the Zsigmondy-Palmer notation. 1, 2, 3, whatever tooth number is given in the Zsigmondy-Palmer notation is going to be used in the second number of it. So you give a 2-digit system, that is 1, 1, 2, 1, likewise. So the first number denotes the quadrant, second number denotes the tooth number, right. So for maxillary first premolar, the tooth number as per FDI system is 1, 4. For left premolar, maxillary left premolar, the tooth number is 2, 4. So here first premolar, remember the number is 4. For right, mirror image of L, 4, and then for left tooth it is L and then 4. Universal system 5 and 12. Whereas FDI system it is 1, 4 and 2, 4. So like the all other anterior teeth, maxillary premolar also develops from 4 lobes. Okay. The only difference is the palatal cusp is going to be well developed, okay, from the lingual lobe. Whereas in case of other anterior teeth, the lingual lobe forms the cingulum. In case of premolars, it develops into a palatal cusp, which is seen very obviously. This is the occlusal aspect. You can appreciate the palatal cusp here. This is the mesial aspect of the tooth. Here you can see a buccal cusp and a palatal cusp, right. So the buccal cusp is going to be long and sharp compared to that of the palatal cusp, and this cusp will help in the canine for tearing the food. And this is a tearing tooth along with canine. Coming to chronology of maxillary first premolars. First evidence of calcification, that is hard tissue starts forming at around the age of 1.5 to 1/3/4 of year, that is around 18 months to 21 months. The first evidence of calcification of maxillary first premolar occurs. This is the timeline. Chronology means timeline. So enamel completion will occur at the age of 5 to 6 years. For the enamel completion to occur, it will be around 5 to 6 years. The tooth, maxillary first premolar, will erupt into the oral cavity at the age of 10 to 11 years. Root completion for the maxillary premolar will occur at 12 to 13 years. So this is the chronology of maxillary first premolar. We should be knowing mainly the eruption dates so that we will know when the tooth will erupt. Sometimes because of decay or because of accidental fall, the tooth may fall and the tooth will take its own time to erupt. So at the timeline when it is specified only, the tooth will erupt into the oral cavity. Just because the deciduous tooth has fall, a permanent tooth will not erupt. So you should be knowing when the particular tooth will erupt into the oral cavity. So for the first maxillary first premolar, eruption date is 10 to 11 years. So from 10 years to 11 years of age, maxillary first premolar will erupt into the oral cavity. Next, coming to dimensions of maxillary first premolar. This is the labial aspect of the tooth, right? Length of the crown is 8.5 mm. Length of the root is 14 mm. So total length of the tooth is 22.5 mm. The mesiodistal diameter at the maximum contact region is 7 mm, whereas the mesiodistal diameter of the crown at the cervix is 5 mm. So this is the occlusal aspect. Here in the maximum contact region, the mesiodistal diameter is 7 mm, right? Next, the buccolingual, this is the proximal surface of the tooth, mesial surface of the tooth. So the buccolingual diameter of the crown is 9 mm. So in the occlusal aspect, you can appreciate the buccolingual diameter of the tooth is more than that of the mesiodistal diameter of the crown. The buccolingual diameter of the crown is 9 mm at the contact region, and the buccolingual diameter of the crown at the cervix is 8 mm. Curvature of cervical line. In the mesial aspect, you can see the cervical line is curved towards the occlusal surface. So this curvature of the cervical line is 1 mm, right? You can appreciate the curvature. The distance between these two lines is going to be 1 mm. The curvature of the cervical line in the distal surface is 0. It is almost straight, more or less straight. Next, coming to terminologies, I have already said flat surface. Okay. When there is an elevation, you call it as ridge. A linear elevation on the surface of the tooth, you call it as ridge. So based on the region where the linear elevation is present, you call it as buccal ridge or palatal ridge. If it is going to be on the buccal surface, you call it as buccal ridge. If it is going to be on the lingual surface, you call it as lingual ridge. There are something called as triangular ridges. So this is a linear elevation on the buccal aspect, buccal ridge. Linear elevation on the palatal aspect, you call it as palatal ridge. A triangular ridge is nothing but you have the cuspal slopes, right? So this is the buccal cusp. So the mesial slope of the buccal cusp and the distal slope of the buccal cusp, you can appreciate it here. So that forms the triangular ridge. So this is the mesial slope of the buccal cusp. This is the distal slope of the buccal cusp. So this will form a triangular ridge on the occlusal aspect, which you call it as buccal triangular ridge. This ridge you call it as buccal triangular ridge. Same way, the mesial slope of the palatal cusp and distal slope of the palatal cusp will form the lingual triangular ridge. When the two ridges crosses the midline, meets at the midline, you call it as a transverse ridge. When the triangular ridges crosses and meets, you call it as transverse ridge. Now coming to different aspects of the maxillary first premolar. In the buccal aspect, the crown of the maxillary first premolar will be roughly trapezoidal in shape. You can see it is roughly trapezoidal. Same way, if you can see in this picture, the mesial outline of the crown is slightly concave from the cervical line to the mesial contact area. It is going to be slightly concave, whereas the distal outline below the cervical line is almost straight. And the contact area, look at the next picture. If you divide the tooth into two halves, from the cusp tip to the cervical line, if you divide it into equal half, the contact region is going to be occlusal to the midway point, right? So here you can appreciate this is the contact region. It is going to contact the maxillary canine. So the contact area is immediately occlusal to halfway point from the cervical line to the tip of the buccal cusp. Similarly, the distal contact area is also located here, occlusal to it. If you look at the curvature of the mesial contact area and the distal contact area, the distal contact area will have a broader curvature than the mesial contact area. The cervical outline of the tooth is almost straight, but you can see a mild convexity towards the root. Here this convexity is towards the root. Occlusal outline will show two cuspal slopes, mesial cusp slope and distal cusp slope. Mesial slope of the buccal cusp, distal slope of the buccal cusp. So the mesial slope of the buccal cusp is going to be straight and longer than that of the distal cusp, slope of the buccal cusp, right. If you draw a straight line, if you divide the crown into two, the tip of the buccal cusp will be distal to the line bisecting the buccal surface of the crown. Coming to the surface, buccal surface, this is the proximal surface. I have kept it to appreciate the curvature of the buccal aspect. So buccal surface is going to be convex, it is not straight, right. The buccal surface is convex and this buccal surface will develop from the middle buccal lobe. Buccal ridge, you can appreciate a buccal ridge which is a continuous ridge from the cusp tip which extends till the cervical line on the buccal surface. You can appreciate mesial and distal to the buccal ridges. You can appreciate small depressions which are nothing but developmental disturbances which represent the demarcation between the middle buccal lobe and the mesiobuccal and distobuccal lobe. You can appreciate the depression here in this picture. Coming to root on the buccal aspect. On the buccal aspect, even though it has two roots, only one root is visible and it is cone shaped and it is going to taper apically. Mesial outline is almost straight to the middle third of the root, whereas the distal outline is slightly convex from the cervical third to the middle third and it gradually tapers to form the middle third of the apex. Next, coming to palatal aspect of the tooth. Here again the crown tapers palatally towards the palatal cusp. Here you can appreciate it is tapering towards the palatal cusp and the palatal cusp is narrower mesiodistally. Here you can appreciate the buccal edges, right, buccal cusp. So it is narrower mesiodistally than the buccal cusp and it has a smooth and spheroidal form from the cervical portion to the area near the cusp tip. And the cusp tip is pointed with mesial and distal slopes meeting at an angle of 90 degrees. Mesial and distal outline is convex and it is shorter than the buccal cusp. So here it is narrower mesiodistally than the buccal cusp. From the palatal aspect you can appreciate, I am going to remove this animation, then you will be able to see the buccal cusp. So the tip of the buccal cusp can be appreciated in the palatal aspect also. And the distal cusp slope, in case of buccal aspect, the mesial cusp slope is longer than that of the distal cusp slope. Here in the palatal aspect, for the palatal cusp, the distal cusp slope is longer than the mesial cusp slope. Can you appreciate that now? Next, coming to mesial aspect. Mesial aspect is roughly trapezoidal except for that the longest uneven side is towards the cervical portion and shortest portion is towards the occlusal portion, right. Buccal cusp is longer than that of the palatal cusp. Can you appreciate? It is longer compared to that of the palatal cusp. Here you can appreciate the mesial marginal groove which extends from the mesial marginal ridge to the middle third of the crown. And you can see a mesial developmental depression which extends cervically from the mesial contact area, continues across the cervical line and proceeds as a deep developmental depression between the roots. You can appreciate the mesial developmental depression. Distal aspect is more or less similar to the mesial aspect except that it does not have a developmental groove or developmental depression will be absent in case of distal aspect. The curvature of the cervical line is often straight. Next, coming to the occlusal aspect of the tooth. The occlusal aspect of the tooth is hexagonal in shape with 6 sides, that is mesiobuccal side, mesial, mesiopalatal, distopalatal, distal surface and distobuccal surface. So it is hexagonal with 6 surfaces and you can see a central developmental groove that is going to divide both the cusp, buccal cusp and the palatal cusp. You can appreciate a groove that is running through between the cusp, right? That you call it as central developmental groove. You can also see the mesiobuccal developmental groove. So extending towards the mesiobuccal side. Next, this is the distobuccal developmental groove. You can appreciate a small depression, line like depression, that you call it as groove. Mesiobuccal developmental groove, distobuccal developmental groove. This ridge, right, on the margin of the mesial aspect, you call it as mesial marginal ridge, and this ridge on the distal aspect of the tooth, you call it as distal marginal ridge, which makes up the margin of the tooth. There is a linear elevation on the mesial margin, that you call it as mesial marginal ridge. So there is a groove that can be appreciated in the mesial margin, which you call it as mesial marginal developmental groove. So with the help of this mesial marginal developmental groove, you can identify whether it is a right tooth or left tooth. Also you can see few supplementary grooves. So coming to the other ridges which is seen on the occlusal aspect, you can see a buccal triangular ridge. I have already said this is the cusp, right, buccal cusp. So mesial slope of the buccal cusp, distal slope of the buccal cusp. So this is going to form a triangular ridge, that you call it as buccal triangular ridge. So the triangular ridge in the buccal cusp, you call it as buccal triangular ridge. Likewise, the mesial slope of the palatal cusp and distal slope of the palatal cusp is going to form a lingual triangular ridge or palatal triangular ridge. A transverse ridge, linear elevation, is going to cross the midline. This triangular ridges meet, that you call it as transverse ridge. The marginal ridge in the mesial surface, you call it as mesial marginal ridge. Likewise, the marginal ridge in the distal surface, you call it as distal marginal ridge. So this is the mesial marginal ridge, this is going to be the distal marginal ridge. You can appreciate depression or fossa within the occlusal surface. So mesial slope of the buccal cusp, mesial slope of the palatal cusp and the mesial marginal ridge. Between those three surfaces you can see a fossa, which you call it as mesial triangular fossa. Likewise, a depression seen on the distal side also, that you call it as distal triangular fossa. To conclude, you know the dimensions of the maxillary first premolar, chronology of maxillary first premolar, and the different aspects of the tooth. You can see buccal aspect is roughly trapezoidal. Only the thing I have already said, the longest side is going to be towards the occlusal surface, whereas in case of mesial aspect the longest side is going to be towards the cervical line. That is the basic difference, and the mesial slope in the buccal aspect is longer than the distal slope. Here the distal slope is longer than the mesial slope, and you can see a mesial developmental groove and mesial developmental depression in the mesial aspect, and the buccal cusp is going to be longer than that of the palatal cusp. Whereas in case of distal aspect it is the same, except there is no developmental groove or depression. Coming to occlusal aspect, it is roughly hexagonal in shape with mesial and distal marginal ridges, buccal and palatal triangular ridges, and you can appreciate the transverse ridge. Mesial and distal triangular fossa also will be seen. So I hope you all understood the morphology of maxillary first premolar. Thank you for watching the presentation.